Training on HIV and AIDS awareness is part of ongoing efforts to reduce the spread of the virus in the region. The training, organized by the National Endemic Disease Control Council, brought together women from all 6 constituencies of Narok amid growing concerns over infection rates tied to certain cultural practices. Our reporter Akida Kasim has more.
The fight against HIV and AIDS in Narok County is gaining new momentum, with women now taking center stage. More than 300 women from across Narok's 6 constituencies converge at the Narok North Youth Empowerment Hall for a 3-day training workshop organized by the National Endemic Disease Control Council, NSDCC. Nixon Chepkonyi from the NSDCC highlighted the urgent need for intervention, noting that over 15,000 people in Narok are living with HIV and nearly 400 new infections are recorded annually.
As we struggle with maintaining people on treatment, we need to struggle to reduce the number of new infections so that we can be able to manage those who are on treatment already. Because if we continue adding new infections into the community, chances are we may not be able to deal with very high people living with HIV in the future.
Chepkonyi also raised the alarm over mother-to-child transmission rates in the country, which currently stand at a worrying 15%, calling for immediate and sustained efforts to address the trend. Community leaders present at the training urged the women to serve as grassroots ambassadors, educating their communities on HIV prevention, the importance of regular testing, and the need for responsible sexual behavior.
Women in leadership can play a big role in addressing some of the predisposing factors to endemic diseases. One of them is the retrogressive cultural practices, which are very common in the communities living in Narok. We know in Narok we still have female genital mutilation, which is a factor in the spread of new HIV.
Tujiangalie na tuweze kumaliza hizi mambo ndio iwache kusambaa katika kaunti yetu ya Narok, kwa sababu tunaona Narok Central imekuwa mingi sana na inaenea kwa haraka sana.
The training marks a significant step in empowering women with knowledge and tools to lead the charge against HIV and AIDS. The NSDCC has pledged to replicate the initiative in other high-burden counties in line with the national goal of reducing new infection to 0.
Ndio tumeambia community yetu lazima tubadilike na lazima FGM iishe, ikome kabisa. Mimi mwenyewe niko na msichana na tumebadilika, hatujapitisha kwa FGM.
Mama akiumia hata jamii itakuwa imeumia, kwa sababu wa mama ndo kila kitu. Kama ni kwenda kutafuta chakula, ni wa mama wanaenda kutafuta.
Armed with the information and purpose, the women now return to their villages, not just as participants, but as powerful agents of change in the war against HIV and AIDS. Akida Kasim, KTN.
Thank you, Kasim. Now, due to rising number of teenage mothers in the country, stakeholders in the health sector have launched an initiative